Open Arms Patient Advocacy is encouraging patients to be proactive in seeking the best possible health care they can, and sort of focusing on self-advocacy and taking an active role in your own health care. And Angelica Martin is here, and Farwa Nauki is here as well, and if you'll please join me in welcoming them to our meeting tonight. Thank you. Angelica.
Okay, hello everyone. Thank you for coming. I know it's rainy and there's stampede, so I really appreciate that you guys came out to learn a little bit about Open Arms Patient Advocacy. So my name is Farwa Nakvi, and I am the Advocacy Committee Chair. So what I do is I handle the cases and distribute the cases to our advocates and that sort of chairperson thing. So a little bit about Open Arms is our mission and vision. So our mission is through advocacy, we encourage transparency and accountability as we empower Albertans. So we're focused a little bit more on Alberta than other provinces so far. And we empower these Albertan patients to take an active role in addressing their healthcare concerns. So that leads us to our vision, and our vision is dignified, respectful healthcare for all Albertans. And hopefully in the near future, I mean, we have handled cases in Saskatchewan, Ontario, and other provinces. We're hoping to expand if we start getting more cases and more advocates volunteering for us in other provinces. Okay. So, where we began is Open Arms really began with the experiences of two families. The first family was the Lundys, Rick and Rose Lundy, and the Donahues, which was Joe and Linda Donahue. Their experiences ultimately led to the question, how can this happen? So some of the a couple of the stories that I share with you are kind of graphic in a way, so if any of you guys feel uncomfortable, you know, feel free to step out, but I'm sure you all can handle that. So, I'll start about Rick and Rose Lundy. What happened was in July of 2006, Rick Lundy and his wife attended a Calgary hospital. Rose, his wife, was experiencing severe abdominal pains, and she was 3 months pregnant. She was told that there was a shortage of beds and that she would have to wait to be seen. However, there were other patients there who noticed that she was bleeding profusely and she needed a bed, and they said, well, she could take our bed. However, she was not given a bed, and due to her bleeding, she had a miscarriage and nearly lost her life. In front of 50 strangers, everyone in the ER, witnessed this tragedy that happened to her. And so because of her life experiences, what happened to her, and her own training, her own passion about healthcare and dignity in healthcare, she and her husband Rick decided they were going to found Open Arms Patient Advocacy. So those are actually some of the news clippings that were on the news after. So another case was Linda and Joe Dote. So in that year, in 2006, in the April, another incident occurred that changed their lives forever. Linda was pregnant in 15 weeks, and they went for a checkup and found out that the baby had died in utero. And so what happened was that routine ultrasound changed her life forever. They were supposed to get a DNC procedure, which is a dilation and curettage procedure in which, they take the child out. But she had to wait 6 days for the hospital to contact her. And, after the procedure, she experienced severe complications to her health care. She nearly lost her life as well. She was stabilized and placed on a respirator in intensive care, and the physical and psychological harm that she experienced with the miscarriage caused her to question the healthcare system. How are we going to fix this? What are we going to do about this so it doesn't happen to other people? And so they also helped found Open Arms. So who we are is we are a grassroots organization. We're run by volunteers. Every single person in Open Arms is volunteer run, except for one. We have a paid intake coordinator who intakes all the cases. And all of our advocates are trained in various areas. So we just actually had a new advocate come in who is a neurology student. So he deals with a lot of neurological cases. We have people, advocates that can deal with psychiatric cases, elderly cases. So we do a wide range of cases, and we handle them through our various advocates. So the intake and coordinating with an advocate is, I'll give you an example. We actually had a case in where an elderly dementia patient was not willing to take a shower at a hospital in Calgary. And, he didn't want to. However, when the nurses were trying to push him to get a shower, he started getting aggressive a little bit, and the security guards very, very aggressively handcuffed him, and it was a negligent behavior. So his wife actually came to us. She was our client, and we had to work our way around of getting an apology and implementing that this does not happen again. So we actually worked around it, contacted the units, dealt with patient relations. Patient relations is another part of Alberta Health Services. We don't work with Alberta Health Services, but we do work with alongside them to help solve some cases. And the unit came up with an apology and implementation, so something like that does not happen again. So that is kind of the case work that we deal with. And what happens is you fill out a form, let us know, your dilemma. We contact you by phone, give you an advocate as quick as we can, and then we work our way around the cases. So now I will turn to my colleague, Angelica, and she will do the rest of the presentation.
Hi there. So when it comes to asking questions, this is our strategy and our system navigation. Our advocates and our clients work together to identify the client's needs, and we then develop a plan to address the unresolved questions and concerns that a client may have regarding their healthcare and treatment options with their medical professional or team. We do believe in working as a team with patients to guide them in finding the answers that they need to feel reassured of the efficacy and safety of their treatment plans and satisfied with their healthcare outcomes. It's our goal at the end of the day to ensure that these patients are given the correct tools at the correct time to navigate the system with as little stress and confusion as possible. How we help advocates and clients thrive. We are firm believers in educating our clients. Yes?
Have 6 inches closer to the mic, something like that.
Little better?
That's much better.
Good, sure. All good? Okay. So, open arms advocates encourage their clients to actively participate in self-advocacy while working to address their concerns. The end goal for us is to ensure that clients feel empowered to take an active role in effectively managing their current and future healthcare outcomes, as well as confidently and respectfully communicating with healthcare professionals when they feel that their own needs have gone unmet. Our personal approach is much more holistic and integrative to the patient experience than some people are used to experiencing. Any healthcare-related experience, particularly a negative one that goes unaddressed, can have severe physical, emotional, social, and mental consequences. Clients who have had a negative experience with the healthcare system are particularly vulnerable to these repercussions. At Open Arms, we seek to provide an outlet to alleviate some of the pain of these experiences. Through empathy, respect, and collaborative partnership with our clients, we work to bring them peace of mind that only closure and resolution to their concerns can provide. Seeking solutions. We seek to reconcile past and present experiences. Because negative healthcare outcomes can make such a lasting impact on a client's perception and confidence in the healthcare system, we seek to reconcile the differences in their experiences navigating the system alone versus navigating it with our support. Intimidation, fear of subsequent neglect, and fear that a question might even be interpreted as a challenge or attack on the practitioner's professional authority. These are all issues that are often cited as the primary reasons why patients shy away from seeking clarification on how their treatment works, what side effects they can or should expect, and how their medical team came to the decision that their specific treatment was the best available among all the other alternatives. Without the confidence to seek that clarification and ask these types of questions, patients often suffer from confusion, apprehensiveness, and they even fail to report any negative health outcomes they may be experiencing as they occur in the moment. Communication. We seek to provide clarity. We encourage full transparency in the doctor-patient relationship, and we lead by example through our relationship with our clients. We're all about teaching our clients how to ask the right questions to ensure that their needs are being met. As the nature of many of our clients' experiences is often very time-sensitive, our advocates also maintain timely, regular communication and consult with clients about the next step to address and eventually resolve their concerns. So at this time, we would like to express our heartfelt thanks for inviting us to present here at Prostate Calgary. We would also like to encourage any questions or comments coming from the audience and let you know that we are definitely available through our website, by email, and for anyone who would like to get in touch with us about their own experiences as a patient, family member, or concerned friend. Thank you so much. We do also have brochures about our organization on the table there if you were interested in picking one of those up.
So if anybody has any questions, you can ask anything, and we'll answer it as best as we can. Yes?
How do the health professionals receive your input, your involvement in a situation? I mean, basically, if I'm a patient and I'm not happy with my doctor, and I've got you involved, is it going to make the relationship I have with my doctor worse rather than getting better?
So that's actually a very good question. That's one of the biggest things that our patients, our clients ask is, well, I don't want it to strain our relationship with our primary care provider. And surprisingly, when we do, if we are able to, we do attend doctor's appointments with our patients, and we introduce ourselves and say we are patient advocates and we're here to mediate the situation, clarify things between you guys just so there's transparency, and we are not here to attack you or anything of that sort. You know, we make it very, very clear with our introduction, and the healthcare providers take it very, very well. They're very open, and they're happy that, because if they do have an issue with the patient, they will be more willing to speak if there's somebody there to mediate the situation. So they handle it very well. Usually, sometimes if patient relations is contacted, which works with Alberta Health Services and is on their side, then the physicians don't want to deal with patient advocates until after an official Alberta Health Services meeting.
And just to add to that, I'd like to add my own experience with probably one of my first clients, actually. I can't provide names, obviously, for confidentiality reasons. But one of my first clients was someone who actually was a very recent immigrant, and she was having a lot of trouble expressing her concerns. There was a certain culture barrier associated with expressing what it was that she was trying to get out of her healthcare. In some instances, you're absolutely right. Some of the doctors do see the communication coming from their patients as a threat or a challenge to their medical authority. So what ended up happening with her was as soon as I got involved and started communicating with the team, letting them know, this was really not at all this patient's intention. What she was looking for was clarification on X, Y, and Z. How can we make this smoother, and how can we backtrack and get to the right place? We certainly find that it's beneficial for two reasons. One, they feel like the communication is much smoother, and two, it makes the process much more efficient in terms of not needing to spend as much time with the patient to understand what their needs are, especially with patients who are dealing with particularly emotionally charged situations, as many do. It's helpful to have someone there who is a little bit more emotionally removed from the situation, so that they're able to clarify perhaps within chronological order and in a different sort of language on a peer-to-peer level with those doctors.
So I can just ask, it sounds as though Alberta Health and accept you. What's the matter?
A little louder.
Oh, I'm not speaking loud enough. Oh, sorry. It sounds as though Alberta Healthcare accepts you and allow you to be present in these meetings with patients, between patients and doctors. What about the private situation where you've got nursing homes that are privately run for profit, where there are concerns there? Do you find it's more difficult to represent or be with family members if there's a loved one in a nursing home that's going through some difficulties or isn't getting the sort of attention that the family think they should be getting? Do you find that's more complicated? I don't know if that's the right word, but more difficult to become involved with?
Now, typically, insofar as that person is their own guardian, we do provide them with waivers, confidentiality agreements, and an agreement that states that they are agreeing to participate in this relationship with us and have us speak on their behalf. We have not run into very many problems. Yes, it is more common with privately run clinics and organizations. However, it's more coming from the skepticism associated with, okay, where are you coming out from? You're all out of left field. So what are we going to do to make sure that the patient actually is consenting to having this communication between all us? Usually that just takes one quick sit-down meeting with a manager or with the main healthcare provider that is looking after the patient, and we're usually good to go.
Mm-hmm. So I actually had a case recently dealing with a nursing home, and there needs to be transparency about guardianship. Some seniors are deemed not their own guardians for whatever reason because they aren't able-minded or coherent enough. So we have to advocate for them because sometimes they don't get the treatment that they need. And so it becomes very clear that we have to, like Angelica said, be very vocal and have all the documentation that we get signed to let us advocate for them. Usually care homes are a little bit more, you're right, wary about their own privacy and confidentiality, but it has not caused us major problems so far. Yes?
Most of the people that I know who function in an advocacy role have extensive education, training, experience, background. What are the qualifications you require of volunteers?
So, because we are volunteer run, we do not do as much as paid advocates do. What we screen for is advocates who are studying in the healthcare field or had work experience in the healthcare field, advocacy skills, and we really interview them, see, well, Are you confident enough to mediate a situation? Are you confident enough to advocate? Because we are volunteer run, we don't have certain criterias in which we have to meet, let paid advocates do, as in certain amount of education, but we do look for a lot of experience or education in the healthcare field. Yeah.
Our particular organization is viewed to be a support organization. And our members have been subjected to every possible disgrace of the body that is possible. And I use that word beneficially in the sense that the reality is that we suffer from living with prostate cancer. In our organization, we have had people who have come and they've been incredibly bitter with their relationship, and some who have gone to the grave pursuing a legal pursuit of their practitioners. And in my sense of this particular disease as we have it and as we know it, there is no outcome that is certain. How do you deal with that reality as an advocacy group versus a support group when the tools are the best that our system can provide, and yet they're not perfect?
Well, first and foremost, many of the patients that actually come to us with a concern or a complaint of some sort, they need that validation. Many times they do not feel that they have been validated by their medical team, professionals, or the healthcare system as a whole. So we seek to provide that little bit of relief by validating that, yes, they absolutely do have legitimate concerns, and yes, we are here to support them. That being said, we do not get involved in legal proceedings. However, we do have 2 lawyers within our network that will provide assistance to those who are seeking a legal recourse. And they will often provide free advice to those who are looking for legal counsel. And that's just to get them the idea of whether or not they really have a leg to stand on, so to speak, in court, especially given that the system is very heavily geared to maintaining the status quo, so to speak. At the end of the day, what is most important for us is to make sure that patients do feel validated, do feel that we hear their concerns, and are doing everything possible to make sure that those concerns are being met.
So I'm going to challenge you with the thought that the professionals that we come to put our lives in, to commit our lives to, they are not committed to the status quo. There is so much advance in research happening that you can either backcast or you can forecast in your position. And so again, I ask, how does your organization address support in the reality of where the science is at and what have you, versus advocacy for genuine malpractice? Because if I hear advocacy associated with the system not responding, that's a malpractice issue of some sort. But I have to think that for the 1,000 members that we have, they have had experiences that are relevant to the day, and then their bodies took over. And either they were friendly to the disease, or the disease was friendly to them, or it wasn't. And so when we have members, and I know this personally, when we have members that have come in and they're going to say that I'm going to sue my family practitioner for not doing this, give me a break. The disease is not that certain. Life is not that certain. So from an advocacy point of view, for genuine malpractice or unfortunate practice, however that's called, I can see a very positive role for you, but the gap is I don't see you being disease sensitive. How do you respond?
Would you be able to clarify for me what you mean by disease sensitive in this instance?
We have every man here who has had his own individual experience. And that man has to develop a relationship with the practitioner, the advisor. I believe there's a role for the independent consultant in the Canadian medical system. We don't have that today. We only take it as far as good practice, and we say that we do everything the best that we can. But to drill down that next level for independent advice, we don't have those practitioners in the field, because that's not the basis of the Canadian medical system.
Right. So one of the first challenges that we often run into with a situation like that is it's difficult for patients who are just absolutely devastated upon receiving the news initially. They don't know exactly where they're supposed to turn for support, if there is anyone else out there who is experiencing the same sorts of things. One of the first things that I tend to do as an advocate is ask them if they would be open to looking for those resources. They might not be ready at the time, and that's okay. We all process things in our own time. Once they are, if they do get to that point, my first step, if I do not already know which community resource would be available to them, would be to call 211, which is the Human Services line here in Alberta, and I will reach out to them about a number of different resources. I will do the legwork and present to the client that we are working with exactly what the options are, what they look like, and come to an agreement with them what they feel would be the best fit for them, if any. Because we do not provide direct counseling, we do obviously direct people to counseling services if they feel that that's something that would be helpful to them versus group support networks. Some people do prefer the individualized approach versus the group approach, and that's completely fine. But you are absolutely correct. It is very difficult to come up with an individualized approach when the services that do exist out there are very poorly advertised as it is. So it's our job to go out there and do a little bit of digging and find the best fit solution for the client at the moment.
Okay, Canada being a multicultural country, and you involve so many aspects of the patients. So do you provide any interpretation service for your patients?
So we do have a multicultural array of advocates as well. Some of the cases which I know have language barriers or cultural barriers, and if I am homogenous to it, I will take that case because I know that just the language homogeny means so much to our client. Because most of we only have 5 to 6 advocates, it's hard to find different interpreters, and all of our advocates are culturally sensitive. So we do try to work around it. I have dealt with people who speak Spanish only, people who only speak Urdu, and we try to work around it. We try to be sensitive to how they're perceiving their healthcare, and that's the best way to approach it. I think we have been able to provide good service to our minorities, and we're more than open to accept more.
Just in addition to that, we are aware that there are interpreter services available through Alberta Health Services Patient Relations Department. So we will often defer to them to find an interpreter to work alongside us. And of course, we check with the patient beforehand to make sure that they provide their consent before we go ahead. The last thing we want to do, of course, is to breed any animosity if we suddenly surprise them with an interpreter service. So,
Yes.
I have a question for you. Most of us that are really been, okay, fine, we have prostate cancer and we've been given what our score is, etc. And the urologist we go and see many times only gives you 2 options. There are many options out there. Now, why is that?
So just to rephrase, you're saying why are we only given a couple of options when there's a wide... Yes. Well, I cannot answer from the medical perspective. However, for medical professionals, they're very linear in their approach. It's lab work, biopsies, treatment. What we work on is, well, support. Financial support. We could guide you to financial support, counseling, therapy, advocacy. If you're a urologist and you are not meeting eye to eye, even if you need support going to a biopsy, or you just want somebody there to talk to your urologist for you because you have so much anxiety, that's what we can provide. We provide services that are outside of the medical practice. We try our best to help them understand, well, the medical terminology as well, because sometimes, men who get prostate cancer, because it's such a whirlwind, they cannot fully absorb what's happening with them. So we do try to mediate and support them throughout their treatment process.
I understand that, but you would not give the patient other procedures that are available for curing the disease.
So for us, what we will do oftentimes, especially if the patient feels like not all of the alternatives have been presented to them, for example, they've gone and done their own research and seen, hey, a bunch of other options are available. Why are these not being explained to me? We get involved in communicating with the medical professionals and let them know, the patient is really wondering why this wasn't suggested. We want to clarify that and make sure that the patient understands why the medical team has made the decision that they have and why they're presenting these treatment options over all of the alternatives available. We have had some cases where patients have come to us and asked us why we don't have certain treatment options available, or why the government does not cover with their own funding other procedures that are available in places like the United States. In an instance like that, we do refer to our legal team and find out, is there any way that we can refer to the Canadian government for the option to cover this procedure. This person looks like they've exhausted all of their options and they're not comfortable with this standard treatment. Why are we not offering them this alternative treatment? Sometimes we're fortunate enough that it is possible and the government will cover, and other times, unfortunately, our hands are tied by other legislation.
So there are other options available, definitely, for any procedure, for any ailment. But we have dealt with cases in which the procedures are provided in the United States, and then we have to go through a whole process of, other options, and sometimes they end up negative, sometimes they end up positive. So yes, we do utilize the legal aspect of things more often than not.
Yes.
Did you have a question in the back? Yes.
Yeah, can everybody hear me? Yeah? Okay, I have nothing but praise for the medical staff that took care of me, with my prostate issues. But even during the procedure, there was a lot of cracks that I fell through. And even today, I've never really talked about them. But I always wondered, had I had some place to go to address these issues, that perhaps in the future, people that are in the same situation myself, might not have to go through that same experience. One of the things that I was, I thought I was well prepared to go to the surgery and, eventually make my recovery. But, having looked back on it, after a couple of years, I can say it was, to me, it was a complete nightmare. My decision to pursue the type of treatment I went through was based on where I'd be able to park my car. So it was easier to park my car in Lethbridge, so that's where I ended up, going for my treatment was down there. Now, one of the things I was really, really concerned about was that after my surgery, I had, being pumped full of morphine and Demerol and, all these other painkillers. On the second day, I was discharged from the hospital. And at that point, nobody even checked on me. I climbed into my car and I drove home. And, I was going, I figured I was going up, the right road. And all of a sudden, I met a car coming down towards me, which should have been on a one-way. And I wasn't too sure if I was going up the one-way or if they were coming down the one-way. Turns out I was still driving better than the people that were coming at me. They were going the wrong way. So I get home and I spent, I immediately end up in emergency that same night at a blocked, what do we call that tube, that catheter tube. So I ended up over back in emergency. But yet, while I was in the hospital, I was very concerned because, I hadn't slept for, since the surgery. They wake you up every few minutes and they, take all the readings. And, then after 2 days, you're out and you're gone. Really in no condition, to be out driving around, like going on. But those are some of the things I experienced, and I never had a chance to, to go meet somebody and, kind of share that experience with anybody. And, I wanted to find out, how do we stop these people from falling through the cracks like myself?
Okay, so what happened with you is definitely an individualistic case, and you do want to stop it from happening to other men who are going through what you went through. If you had come to us, we would address that issue with the unit which treated you. So if it was the ER, we would have addressed it with them. It's good to have all your medical records with you, just so we know who we talk to. So, the nurses that dealt with you, it's good to take notes and record everything that's happening, as in your procedures, what time your procedures happened, who your doctor was that was treating you, who was with you, everything, because that is your information. And with that information, if you came to us, we can contact those individuals and talk to them on your behalf. And worst case scenario, if the unit does not listen to you, if Alberta Health Services does not listen to you, we've had a couple cases in which we actually went to the media. And Angelica's our media person as well. So we go to the media, we talk to the newspapers, and that gives a lot of attention and credibility to your story, and it makes sure that it does not happen again. Usually when you contact Alberta Health Services and, they accept their wrongdoings, they will, if you request a meeting, they will have a meeting with you. Or they will give you a paper, like pages upon pages of, what they can do to make sure it does not happen to other people. We've had this done before. We've had media attention given to a story before too, just so it does not happen again.
I'd just like to add that there is absolutely no limitation on when you choose to address those healthcare concerns. A person could experience something 5 or 6 years ago, for example, and say, you know what, I really never got closure or resolution to why this happened, why certain decisions were made by my medical team. Can we go back and revisit that? We can absolutely do that. That's what Alberta Health Services Patient Relations Department tends to work with us in tandem on. We refer to them to get the patient's full history as well as to get a chronological timeline of exactly what happened, why certain decisions were made, and hopefully that does provide the client with closure. More often than not, it does. Occasionally we do run into some snags that require a little bit more extensive research, but that does happen. One of the more ambitious projects we're actually working on right now at Open Arms is getting our database up and running, because we would ideally like to have some understanding of exactly how many cases we receive for each particular medical concern, what has happened, so that we can provide this data at some point as a means of really understanding among ourselves and among the other organizations that we work with, what are we seeing the most of in Alberta, and how can we work to really pinpoint these, right? It helps to understand what is being missed more often than not, and why exactly that is happening, whether it's the lengthy wait times, which is universally an issue for most people in the province, or has it been an issue of them being discharged too early, such as may have been very likely in your case? What can we do to prevent that? What sorts of statistics back up what we should be doing to prevent that? Yes.
I want to congratulate you for your efforts and the purpose that you serve, and that is the patient. One of the dilemmas that we have as an organization, it's not a particularly high issue for us, but it is still a dilemma. Sometimes we can know too much about our particular disease and the therapies that theoretically are available, because we seek out information from the United States, and indeed we are sending, as you now know, 3 of our own representatives to the Prostate Cancer Research Institute conference. They are going to come back with information that cannot be implemented in Canada or in Alberta within perhaps a 5-year time frame. That doesn't mean to say that it's not beneficial to send our folks down there, but how do you draw boundaries between the services that are genuinely developed with the interest of the patient in hand, with the best of the medical knowledge and advice available, and implemented in Calgary, versus what we might be able to achieve, or an individual could achieve, if they went outside the province, as you did,
Yes, I did.
or others who went down to California or to Florida or to Arizona for highly specialized treatment that might be viewed to still be experimental. So now we've got a population of people that we must serve in Calgary and area, and yet at the same time, we as an organization feel very much compelled to advising of what might be available elsewhere. Where does your organization come in dealing with the advocacy associated with what's available here? We have people from Calgary that can afford anything anywhere.
Absolutely. So first and foremost, we are all about transparency. That means presenting all of the options available. We do not believe in keeping any patients or clients in the dark about, what might be available to them. It is ultimately their decision, and we must respect their independent decision if they choose to go for a particular option. If it is viewed as something experimental, then again, it comes down to us to figure out, why is this viewed as experimental? What have been the success rates? And it comes down to understanding the statistics from more than just, a face value perspective. You can't see a statistic and think that that is the be-all and end-all if something shows a 95% success rate as an experimental procedure versus a 75, let's say, percent success rate for something that's well established that would be locally available. So if that 95% success rate, for example, is attributed to a very small sample of subjects, people who actually underwent the clinical trials, we want to make sure that our clients are aware. Yeah, it says 95% success rate, but at the end of the day, there were maybe 100 people who underwent the clinical trials versus the 75% success rate available locally that thousands upon thousands of people were subjected to. So it's about understanding the checks and balances in terms of how successful it is for larger populations and what that translates to in terms of it likely being a positive outcome for the client. Again, it is ultimately their decision, but we want to make sure that they're making the best informed decision possible, especially if they're going to be taking, cash out of pocket to take care of a procedure elsewhere.
Yeah, with some of the procedures, usually we're looking at the client having to pay out of pocket, and that's when the legal proceedings do happen, in which we want Alberta Health Services to pay for their treatment outside of Alberta. We do deal with some cases in which if suppose Alberta Health Services does not want to do the surgery, for example, we will reach other hospitals in Canada, on our client's behalf, Toronto, Montreal, wherever they want and are able to go, so they could get the procedure that they need. We know Alberta is limited in some areas more than not with certain ailments, so we do provide transparency and we do our own research to bring to the table to our clients.
One final point.
Yeah.
We do advocate for our clients, but in a different way than what you've described. And the best way that I can describe it is when we know of coverage for a particular disease condition that's specific to prostate cancer that is covered in another province but not covered in Alberta. We do address that either as an organization or through the Canadian Cancer Survivorship Network. That's a useful role for us to play in advocacy. Quite frankly, we have not, as an organization, in my 8-year history with this organization, got into advocacy for an individual. What we do is we're committed to educating as best we can and informing, and then leaving the individual to make their best decision based on the knowledge available. That's maybe the point of difference between us.
Yes.
But I do congratulate you on everything that you're trying to accomplish.
Thank you. Thank you.
If I could just follow up on what this gentleman has just said, you could take that a step further by, if somebody knows of a procedure, say in BC, that's done in BC, covered by the health of people in BC, but not covered here, patient here might want, an individual here might want to get that treatment in BC. You could probably assist in finding out or helping that person find out where they could get that service at a cost, and perhaps even helping to submit to Alberta Healthcare a good reason to have that funded. May get turned down, but presumably you can play a role with that and would know how to proceed. Is that? Do I understand that?
Yeah, that's a very good point, and we try to do our best with that, but we will definitely take that home with us. We learn from experience from different cases. The more knowledge we get, the more knowledge we research, we do implement that to similar cases that we do receive. So that is a good point, so thank you.
We absolutely do advocate in those circumstances for a person to, again, make the best decision possible for themselves. And if they feel that going out of province for a treatment is something that they would like to do, then we will absolutely look into the rules, the legislation surrounding whether or not they're going to be able to go and do that, how difficult it is, what sorts of hurdles exist, and what the timeline would look like to get over those and actually get to that treatment. One example I can think of actually comes from women's health, and one of the biggest hurdles was that one person that I was dealing with She very strongly believed that current IUDs here within the province and within most of Canada actually are leagues behind some of the IUDs that are available in Europe and, in fact, in China. So one of the issues was that they had brought over a particular IUD, much smaller, much more effective, apparently in some clinical trials in Europe, than most of the ones that we currently have here. She really wanted to go and get it done over there in Vancouver. Now, what she was not aware of was that, yes, there was a single clinic in Vancouver, a single clinic in the entire country that provides fittings for this particular IUD. However, those fittings were part of a clinical trial to actually have this approved in Canada. So it's up to us to kind of help them understand, yes, this service might be available, but it might not quite be available widely as of yet. This was a recruitment sort of activity, finding clinical trial participants, and we were likely at least 5 years away from actually having this readily available in Canada versus going to Europe or to China to have this particular device fitted.
Okay. Thank you guys so much, and those questions were great. You really drilled us. I mean, this is our first presentation, so we really do appreciate you guys coming out and supporting us and learning more about us. If you guys have any questions, please, you have the brochures, contact us. Because we have a limited amount of advocates, we do try and work as fast as we can with the cases. We're hoping to expand a little bit more, but if you have anyone dealing with different issues other than prostate cancer, you could definitely contact us and we'll try our best. Thank you.
Thank you.